So anti-anxiety medications versus hypnotics. The difference between these two is going to be in the dosage. With low dose, it's going to be anti-anxiety. With the higher dose, that is going to be for sleep or a hypnotic. So again, very important to know this. Know that with anti-anxiety, that is going to be low dose, and with high dose is going to be sleep. The different agents, the benzodiazepines and the selective serotonin uptake inhibitors, both used to treat anti-anxiety or both used to treat anxiety. Selective serotonin reuptake inhibitors developed as antidepressants, but also very effective against anxiety. And that was covered in Chapter 4. Now let's talk about benzodiazepines specifically. And let's talk about the mechanisms of action on these medications. The way that benzodiazepines work, and remember that the neurotransmitter that it affects is GABA. Okay, make sure you know that. It decreases the excitability of the neuron. It sort of suppresses that. Think of it almost as a glass of wine, or putting the brakes on something. It reduces the communication between neurons and therefore has a calming effect. So it just sort of putting the brakes on that. Benzodiazepines are indicated for short-term treatment. Very important, short-term. Remember, it is a controlled substance. It is a C4. Make sure you know that. Lots of uses. Benzodiazepines are very effective. Very effective. They work well. Remember, with our SSRIs, we're looking at 2 to 4 weeks. With benzodiazepines, we're looking at about 30 minutes. So they have a much, much quicker onset of action. The use, lots of uses. Pain disorder, generalized anxiety, phobias, insomnia. Lots of uses with our benzodiazepines. Also, maybe the patient just lost a family member and is upset about that. Going through divorce, upset about that. Paying a lot of alimony, maybe they're upset about that. And you're treating acute things with benzodiazepines. Remember, benzodiazepines are indicated for short-term treatment, not for long-term treatment. Some side effects of benzodiazepines. Dizziness, fatigue, drowsiness, which would make sense, right? Impaired judgment, dry mouth, visual disturbances, rebound insomnia, and the biggie is this potential for developing tolerance. Benzodiazepines, pregnancy category, we have not discussed pregnancy category yet, and we will discuss pregnancy category Monday, because that was not discussed, I don't believe. Have we discussed pregnancy categories? Okay, so we'll discuss pregnancy categories Monday. I've got a short little presentation on that. So I'll do that Monday. But benzodiazepines are a pregnancy category D. Actually, we can start our little presentation now if we look in our little book. And in our little book, we're looking at page 8, which at the very front, which is a VIII. So you're looking for 8 VIII. And you'll look on the left-hand side, and you'll see safety in pregnancy. Does everybody see that? And this is a category D. So what does category D say? Unsafe. Okay, so the drugs throughout this book, you will see that it is given a pregnancy category, and to look up what that pregnancy category is, you can refer back to the front of the book. So this is a pregnancy category D, and also we need to be careful about benzodiazepines. Use caution in elderly and patients with respiratory problems. Also, benzodiazepines may interact with alcohol. Benzodiazepines are a central nervous system depressant. So is alcohol. So you don't want to play Michael Jackson the home game or Heath Ledger the home game. So you have to be careful with benzodiazepines. So, some examples of some medication. I'll briefly mention a couple of these, but we'll open up our book, and we'll also open up our little drug book, and we'll go over these in a lot more detail. And I'm just going to move on for now. But don't mark this slide off, because you may use this slide or the book or your little drug book, because I'll say, give me an example of a whatever. But I'm just going to go on. But we'll look at the book and the drug book in just a few moments. Benzodiazepine-like drugs. So these are going to be drugs that act sort of like benzodiazepines, but are not a controlled substance, or are not benzodiazepines, but they work similar to benzodiazepines. Medications are effective hypnotics, low potential for tolerance or abuse. Benzodiazepines are widely used. They are used a lot, and they are very effective. But again, we have to be careful with our benzodiazepines. The benzodiazepine-like drugs have a similar mechanism of action as our benzodiazepines do. And those medications are approved for short-term use, except there is a special case with Lunesta. There is no particular amount of time with Lunesta. And Ambien, for example, is also approved as a hypnotic for sleep. Ambien is only approved from the FDA for treatment of 14 days. But Lunesta, there is no certain time limit on that. And Lunesta is a controlled substance as well. It is a C4. Rozerem is the only drug in this class that is not a controlled substance. Rozerem is also a medication, or is also a hypnotic used to treat insomnia or sleeping problems. Side effects. The only thing I'll mention up here, because you'll see this dizziness, headache, nausea. You'll see that with all drugs. If you look in the drug book, fast comparisons, whatever, you'll see that listed for all drugs. So when you see dizziness, headache, nausea, etc., those, I'm not going to ask you, is there any unusual side effects on something like that with the dizziness, headache, nausea, because that is potential for all drugs. Something that I will mention, though, here is going to be this daytime drowsiness or drowsiness, the potential sort of a hangover effect. I will mention that one, so you might want to underline that one. The first one. Benzodiazepine-like drugs are contraindicated in patients with alcohol intoxication. Kind of makes sense. Depressed vital signs or a comatose patient. The other thing is if we have a comatose patient, they probably are going to be sleeping. They're probably not going to have insomnia. So that's probably not going to be an issue with them anyway. And you want to use caution in patients with liver, kidney failure. Makes sense. We know why, or diminished function. You need to be careful with elderly patients. The reason we keep putting elderly patients up here for multiple reasons, you know, their liver, kidney function is going to be decreased. They're going to be more sensitive to drugs. There's also potential of it affecting their respiratory system if they're taking multiple drugs. The chance of side effects are going to go up. But also, we don't want a patient to get up and fall down and break a hip because the medication is causing drowsiness either. So multiple reasons with our geriatric population that we have to be careful with medication or over-medicating as well. Benzodiazepine-like drugs are less addictive. And you should not use them with other CNS depressants, so we should put the patient on 2 of the same medication. And Buspirone or Buspar can increase the risk of digitalis toxicity, which is what, Lanoxin, right? So that may be important. And we'll come back to Buspirone or Buspar. I've got a couple additional slides on that in just a few minutes because that one's sort of a special drug. But I think that's important. Digitalis toxicity, the brand is Lanoxin. The generic is digoxin. And the condition, the overdose, is called digitalis toxicity. So if you have a patient who is taking Lanoxin, then what would be a drug that you would want to avoid? Buspirone, right? Right? Okay. Barbiturates. Barbiturates depress multiple functions, multiple CNS functions. It can be used for lots of things: sleep, seizures, generally anesthesia. They can cause tolerance and dependence. That is one of their major things that can and will happen. And you want to be careful with the respiratory problems because they can cause respiratory depression, leading to respiratory arrest. So you really have to be careful. Barbiturates depress the CNS, the central nervous system, by affecting that GABA neurotransmitter. The second bullet, as long as you know the first bullet point, you're fine. Second bullet point, it's nice to know, but I'm not going to get that detailed on the midterm or a quiz midterm. I'll mention it, but I'm not going to get that specific on the second bullet point. Does that make sense? So with barbiturates, it's going to affect the chloride ions movement into the cell, which will suppress the ability of the neuron to fire, which sort of summarizes how benzodiazepines work with our GABA receptors that I mentioned before. But as far as these chloride ions, I'm not going to get that specific. Barbiturates cause numerous adverse effects. It affects different parts of the body. The barbiturates are a very powerful medication. I'll mention two things here as far as the side effects. I'll try to only mention the ones that are really important because, like I said before, when we get to, we'll start looking at different, as we're going through this class, look at the different classes of drugs. We'll see nausea, vomiting, dizziness, headache. We'll see that listed for all drugs. So if there's a special side effect, then don't pay attention to those. So, but there is a couple here I want to mention. One is going to be constipation. And the other one I'll mention is this drowsiness / hangover effect. So those are the two I want you to underline there. Are we good so far? Pregnancy category D. I will not, the quiz Monday will not have anything about pregnancy categories in there because I want to give you a separate little lecture on pregnancy categories. So for the quiz Monday, pregnancy categories will not be listed. It should be used in caution with the stuff that we mentioned before, which majority of drugs should be careful if you have liver kidney problems because that can affect the drug being metabolized and eliminated from the body. And if you have geriatric patients for what I mentioned before, and respiratory patients for what I mentioned before. So all the stuff is the same on there. Some miscellaneous drugs. So these drugs sort of fall into a special category. Buspirone, atenolol, propranolol. Notice that atenolol, propranolol both end in OL. So what class of drug is that? Beta blockers. Very good. Very good. Let's talk about Buspirone for a moment. Buspar is the brand on that. There are 3 advantages of using this over benzodiazepines. A couple of those is it does not cause sedation, or let me rephrase it just a little bit. It does not cause as much sedation as the benzodiazepines. So when you first put a patient on Buspirone or Buspar, there could be some sedation just until the body adjusts the medication. No, abuse potential is not a controlled substance. It's not a controlled substance. And it does not intensify the effects of CNS depressants. Buspirone is as effective as benzodiazepines. And Buspirone functions as a serotonin receptor partial agonist. And we'll discuss what that means. Because your next question is, what is a partial agonist? Well, I'll show you in the next slide. Additionally, it functions as a dopamine antagonist. So what that means is that it helps release the serotonin and it blocks dopamine. So to summarize the second bullet point in the third bullet point. So what I mean by it functions as a serotonin receptor partial agonist, and I'll explain what partial agonist is on the next slide. Also functions as a dopamine antagonist. So it's going to help release serotonin, and it's going to help block dopamine. Is everybody with me on that? Okay, so the third bullet point is just explaining the second bullet point. Now let's talk about what a partial agonist is. It's going to bind to that receptor site. So we're talking about partial agonist here. It's going to bind that receptor site. And it's going to be only have partial efficacy at that receptor compared to a full. So it's sort of like instead of going 60 miles an hour, you're just going 30 miles an hour. So instead of going 100%, it's just going to go 50%, about. And that's what we're looking at here. So here would be a full agonist, which would be the red line, and then the green line would be partial. Does that make sense? Buspirone, lots of indications, treatment of anxiety disorders, treatment of generalized anxiety as well. And remember, it's not a controlled substance. Buspirone is well tolerated. It's non-sedating. It does not interfere with the daytime activities. And as far as special side effects up here, there's none up here I'm going to have you underline, but these are possible ones, but not. I'm not going to require you to memorize any of these because these are not quote-unquote special. Let's talk about miscellaneous drugs, atenolol, propranolol. You said they were what? Beta blockers. And let's discuss why they are beta blockers. Let's take a look for a moment. I'll pull it up here. So, while I'm pulling this up, walk me through an anxiety attack. I'm having an anxiety attack. What am I going to be experiencing? What's going to be happening to me?
Shortness of breath, your heart's pounding, lethargia. You could be crying. I just saw a panic attack at work. Uncontrollable. Yeah, that's fine.
So take a look at our little sheet here. So I'm going to mention a couple of these things and tell me if these are part of an asthma attack. Accelerated heart rate. What about breathing more or heavy breathing? Yeah. What about that? What about you may not know that some of these other things are going on, but some more of your sympathetic nervous system is being activated. You may not know that it is going to decrease digestion. You just may not feel that, or that epinephrine or norepinephrine is being released. You may not feel that. But what beta blockers do is beta blockers block the sympathetic nervous system. So we're blocking the stuff on the right side from happening. So we're also, and we'll just go into beta blockers in much more detail and cover the cardiovascular system, but just sort of a general note now. Beta blockers, which are these two medications here, block the sympathetic nervous system. So they're blocking these things here. Is everybody good with that? No. So how do beta blockers? So why would you give a patient a beta blocker? Minus the cardiovascular stuff. So with this, what type of psychological condition would you give a patient a beta blocker? Anxiety or anxiety attack. And what is the mechanism of action of beta blockers? Well, what does it block? It blocks what? The sympathetic nervous system. Very good, very good. Think that's important? Might see that again.